Inspiring Uganda.
Hello, my name is Ishmael Kathy on the program Safe Life, and today we are going to be talking about HIV/AIDS prevention. I'm with Dr. Mia Yunus from Taso, and he's going to be sharing with us. You're most welcome, Doctor. Please say hello to the viewers and probably add on your other titles that I've forgotten.
Thank you so much, Kathy, and thank you for the opportunity for me to share my experience and views about HIV and Taso in general. My name's Dr. Mia Yunus. I am the head of programs at Taso Uganda.
Okay, Dr. Mia, give us a brief background of Taso, just something small about Taso.
Yes, Taso is the AIDS support organization, and it's a local non-government organization. It's an NGO that started in 1987 by Ugandans in response to the HIV epidemic. During that time when we didn't know much about HIV. And for the last 35 years, Taso has worked together with Ugandans, providing HIV prevention, care, treatment, and support services.
Okay, and what are the different activities that you're doing as Taso to help out on the HIV prevention, to reduce on or to regulate on the spread of HIV in Uganda?
Yes, thanks, Kathy. I think before I talk about HIV prevention, I would like to also talk to the public about the HIV situation in the country. At the moment, Uganda has made significant strides in the care and treatment, but also prevention of HIV. Back in the day, HIV was almost a death sentence, but currently we have treatment. So everyone who has HIV has access to treatment and actually live almost a normal life expectancy. We currently have HIV tests available from those that you can actually use from the facility, but even those that someone can use from home, that we call self-test kits. And we have also managed to reduce the number of HIV persons, number of people living with HIV in the country, what we call the prevalence. Currently we are at about 5.4%. And it comes from a very high rate back in the day when Uganda was at some point above 10%. And that is no mean achievement. It is as a result of concerted efforts right from the government. Uganda is one of the countries that had the best political will to increase awareness, openness, and treatment. And part of it has been the positive attitude of the community, right from willingness to participate, willingness to cooperate, but also the capacity of the community to respond when they are called upon. So in terms of prevention, the challenge we are having at the moment as a country is that we still have new HIV infections that are taking place, despite all the progress that we have made. So the new HIV infections are not as much as they were before, but they are not as low as we would want them to be in this current time. And this has been brought about by a number of things, including maybe people getting used to the fact that HIV has been there. They are getting used to the messages. It's a normal thing. Also, of course, recently we had, even now, we are still having a COVID scare and a COVID scourge, which affected our capacity to reach out to the communities, restricted movements, there was increased violence, and many other factors that could actually lead to an increase in the number of HIV cases in the country.
Going back to my question, I was still asking you the different other activities that you do apart from the sensitization and helping people get to know that HIV is there and the different ways of preventing themselves.
So yes, going a little bit into detail about what we do as Taso, but also what is available at country level. For HIV prevention, I think I will speak about some very quick issues that would help us to understand what people can do, especially around themselves, around home. For us to prevent HIV, we really need to take responsibility at individual level. There are many methods that are available for HIV prevention, but the most important thing starts with the individual.
Yeah,
the individual
understanding
that HIV is still there, like we have discussed, and we can have treatment, but we need to prevent HIV, because the moment you are diagnosed with HIV, yes, we said you will not die, but your responsibilities will increase. You will have to take personal responsibility to take treatment. So that is not very easy for most people.
It's not easy.
So as an individual, you need to not only get interested in learning about what HIV prevention entails, how HIV is transmitted, and then take the initiative to implement some of the things that you have learned.
Sure.
We'll go back to some of the scenarios that we have in the country. Currently, you will find out that there is more HIV transmission among women than men. And then almost twice the number of women get infected than men. And then the bigger problem is the number of HIV infections among young girls, 15 to 24 years, is 3 times.
It's 3 times
higher than that among their peers, the males. So it means that the message of HIV prevention needs to be taken seriously across all levels, but more emphasized for these subcategories. Now, what do we do? At the moment, we continue to emphasize the basic HIV prevention methods. The use of condoms, abstinence, and then staying faithful to one sexual partner. However, we have also come up with a number of other methods that are available for different subcategories. For instance, in men, circumcision reduces the chances of getting HIV by almost 60%. So we encourage men to get circumcised. And of course, beyond circumcision, it has other benefits.
It keeps you clean.
It keeps you clean, yes, that is very true. And looking at males, beyond circumcision, for females, we have other modalities. Like we have we call it a ring, which women can insert, and it has drugs that can prevent a woman from getting HIV.
Okay.
There are other drugs that a person can swallow. When you know you are at risk of acquiring HIV, during that period when a person is at risk, they can start taking these drugs. We call them PrEP. And commonly we use them for individuals that are in relationships. We call them discordant relationships, where one partner is HIV positive and one is HIV negative. So if you get
for how long am I supposed to take these drugs?
Usually you need to have a discussion with the health worker to determine what your risk is, and then how long you need to be taking the drugs. But usually you have to take these drugs sometime before, almost a week or 2 before you are at risk. And that is in a controlled environment. But imagine if I just go out and risked without thinking about it. So that usually requires that if you are in that category and in such a risk, then you take the drugs almost most of your time, most of the time.
Going back a little bit, you talked about HIV being more in the young people. How has the peer pressure been so influential to the patients, to the clients, the HIV/AIDS clients, the Taso clients?
I think I'll talk about peers in 2 ways. The peers, especially among adolescents. Adolescents as young people are very influenced by their friends and their peers.
100%.
Yes, how they dress, what they do, they usually look at the cooler guys, and what they do is what they want to do. So in terms of HIV risk, if a young girl is having friends or colleagues that are sexually active, they are more likely to become sexually active.
Definitely.
So that kind of influence can likely increase transmission of HIV.
Sure.
But again, to the HIV treatment, prevention, and so on, peers can be very helpful. And for us in the HIV care programs, we have identified that benefit.
Okay.
And for a very long time, we have been engaging peers in the different categories.
Sure.
Children, adolescents, and other subgroups within the care program. We identify their peers, we train them, and we make them ambassadors. We make them agents for change. And it has worked tremendously well.
Oh, wow, that's really nice. Well, talking about that, having all those peers having to influence the rest, there's this belief that every subscriber of Taso is HIV positive. What's your say about that? Because there's that belief, and I definitely believe it's a wrong one.
Yeah, absolutely. So thank you.
Just throw more light on that.
I think there are many things about Taso that I can talk about.
Yeah.
Taso is a subscriber organization. It was started by individuals that were affected by HIV, not necessarily infected. Some of them had family members that had died, others had family members that were sick, and these came together to put together what we call Taso at the moment. From that time on, Taso has continued to bring in new subscriber members, and each and every one of you is invited to become a subscriber member. By subscribing to Taso, you are actually making a statement to fight HIV at personal level, but also at community level. So not everyone who subscribes to Taso should be HIV positive. We now encourage very many young people to become ambassadors of HIV change, and they join Taso as HIV negative youth, institutions, individuals, and we invite you to become a subscriber member.
Okay, that's good. Well, talking about COVID-19, I believe there was a time where there was literally no movements. And how did Taso manage to continue responding to the clients without hesitation, without limits? How did you manage to do that during that time in terms of service delivery? I believe people have to keep moving to come and get the drugs, different treatments. How did you manage to do that during that time? We had
measures to stop the spread of COVID-19, and those included restrictions to movement. And that was a very big setback for not only the care providers, but also for those who receive care. What Taso did during that time was to work out a program of health workers delivering medicines at home, but also in the communities, and most of the persons who had challenges accessing drugs in that time have started accessing their drugs fully. And much of this challenge comes from during that time, during the COVID time, there were a couple of challenges, including supply chain and so on. But we continue to work with government and encourage our stakeholders to ensure that we have these drugs ahead of time.
Well, talking about challenges, what are some of these challenges that the organization itself is facing, and those challenges that you're facing with the clients, or maybe the clients could be facing?
Yes, at organizational level, and it's not restricted to Taso as an organization. Currently, almost all the drugs that our clients use are funded by donors. And the donors continue to support this, but there is generally a reducing funding trend across donors. And this not only impacts the quality of the services, but also the reach. So that challenge is not unique to Uganda. Many of the different countries face the same challenges, and we think that it is now time that communities, individuals within join the drive, support governments, but also support institutions that provide HIV care to supplement what the donors are able to provide. At a client level, or at the level of those that are in care, the biggest challenges have been really around COVID and access to treatment. And we have worked together and sensitized them to ensure that they are able to access their treatment in time. Currently, one of the major challenges is retention. Somebody is is tested, they're enrolled on treatment, but then they find it difficult to keep taking the treatment, but also keep coming back for the appointment. Because people are healthy and they're busy, so they end up moving to, there are those that move to outside countries for work, there are those that move to other regions within the country and find it difficult to come back and stay on treatment. Now, for HIV treatment to be effective, someone has to take that treatment consistently. You have to show up for your appointment, you have to talk to a health worker, and then you have to actually take the treatment itself. Because of that attrition in care, you find that we still have a number of people that, despite being registered as being on treatment, actually their treatment is not working because of the characteristics that they have in accessing and taking treatment. So that's a challenge, and it's quite disturbing, but I know that with consistent engagement and consistent health education, sensitization, we'll get somewhere. And we are already making progress.
Right. Well, you've talked about having patients who normally miss and probably are not in position to keep taking their drugs in time and consistently.
Yes.
What solutions are you trying to provide, or maybe what's your advice to those people, and as you're also giving us your way forward as the organization in general?
Naturally, problems cannot be avoided.
True.
Individuals live in different circumstances, and there are those that will miss inevitably. But then there are those that just forget.
Yeah.
So what we are doing now is that we are designing programs to remind those that are on treatment by sending either a message or reaching out before, such that they know their appointment. We are also delivering drugs to those that fit and qualify to these different models where we can deliver drugs within their communities. We are also encouraging those on treatment to actually find a treatment partner, a treatment buddy, who reminds you when it is time for you to take your treatment, but also it's time for you to come and pick your treatment. It works very well because as an individual, you find it difficult to track everything. We also encourage those that are on treatment to disclose to those they trust, especially their family members, their spouses. It becomes much more difficult for someone to take treatment for a lifetime.
True.
If and you're hiding from either at school, or you're hiding from your partner, or you're hiding from your family, then it becomes very difficult. We are also encouraging the general public through sensitization to reduce stigma. Yeah. Stigma is one of the biggest challenges that to those
clients face.
Yes, that need treatment. Every time a person is going to a treatment site, then people are pointing at them. That one is HIV positive. That one is going to die, or something like that. So we need to become self-aware that stigma is a challenge not only for those who are HIV positive, but also for those who are HIV negative. Yeah. Because at the end of the day, if this person is not on treatment, then, or they are not adhering on treatment, then they can transmit. Okay. Actually, I will use this opportunity to share that for persons who are HIV positive and they are on their drugs consistently, they're actually unlikely to transmit HIV to another partner. So we should all work together to encourage those who are on treatment to come and seek their treatment.
Well, what's your appeal to the government and the general public?
Yes, I'll start with the government. Currently, the efforts to combat HIV have been seen to stall because of the funding issues, because of complacency and so on. We need to increase financing for the HIV response, right from the ministry to the different levels, including those that are in the front line against HIV. We need to also be able to provide a conducive environment for access to treatment for those that are most at risk. You clearly find that these days data has shown that there is more HIV among some groups within our community: the commercial sex workers, the men who have sex with men, the ones we define as gay, and so on. those who inject drugs. And we have laws that may not be favorable for them to identify themselves as so, but also encourage them to seek treatment. So to the side of government, we really need to balance and think about the impact of our environment in terms of laws and how it impacts those that fail to seek their treatment. To the community and to everyone.
Well, as you're giving out your give out your last remarks as well, thank your partners and thank the people that have enabled you to spread out the news to the different people, and probably share your contact and where people can find you in case there's one and would like to ask different questions.
To the general public, I think I just want to utilize this time once again to highlight that HIV is still a problem and we can still prevent it. We can still play our part through ensuring that ourselves, our partners, our communities are actually encouraged to behave or to work in a way that promotes health but also HIV prevention. For those that are on treatment, they need to be encouraged to stick on treatment and continue to stay in care for as long as their lives are there, because their lives depend on this treatment. With that, I think I will just end and thank my viewers for the great interaction. I sit at Taso headquarters, and we invite you to Taso to become a subscriber member. We invite you to Taso to join in the fight against HIV through your interaction and contribution as a person at community level, but also physically and actively participating in the different activities that we bring on board. Thank you very much, and we wish you a good day.
All right, thank you very much, Doctor. It was really nice having you on the show.
You're most welcome. Thank you, Kathy, and big blessings.
Thank you so much. It was really nice having you. Let's all come together and join in the HIV prevention. Remember, living a safe life is your right and responsibility. I remain Ishimwe Kathy. Stay safe.